All right, we're going to start our last unit in this class, and I just kind of want you to know that we don't have time or reason really in this class to cover every single disease of all the body systems, but I do want to introduce you to some of the most common diseases, and we'll kind of have an order of operations as we approach these last 6 chapters. I will always talk about sort of the anatomical susceptibilities that are present in the human body, and then we'll kind of walk through the most common microbial diseases for that body systems. I will emphasize bacterial disease, but whenever I can, I like to throw in some viruses and maybe a few like other, I don't know, fungal infections as well. And we're going to start with diseases of the skin. And I just want to say this is a fantastic chapter. I highly recommend reading it from start to finish. In fact, I think that the last 6 chapters of this book are the very best of the entire class. So enjoy. Anyway, let's kind of start with just an overview of the skin's defenses. And I gotta tell you guys, like the skin is so fantastic at resisting microbial diseases. There's a few reasons why. First is that natural shedding of the cells. Like as your skin rejuvenates itself from underneath, it just sheds its outer surface. In fact, your entire skin regenerates itself every 28 days, which is kind of a weird random number. I always remember it because it's like one lunar cycle, but I do think that's kind of a weird time. But that shedding mechanism is usually faster than the rate that a microbe can colonize the surface of unbroken, healthy skin. Second, your skin contains 7.5% salt. So when you look at some of the microbial growth like experiments in the second like lab unit, one of the things that you'll sort of watch demonstrated to you is the mannitol salt agar test. And that is not a random saltiness in that test. It kind of is for growing skin bacteria. And that makes sense that it would be a salt tolerant microbe. But for the most part, things like staph, strep, micrococci, those things can live in a pretty salty environment, but not a lot of other things can. Particularly gram-negative bacteria are very susceptible to salt, which is great because you don't want like a million different types of bacteria capable of colonizing the skin. The other chemical defense that's part of sweat is lysozyme. And I've mentioned lysozyme already in this class. Lysozyme is sort of your natural penicillin. It's going to sort of neutralize peptidoglycan in the cell wall. And remember, gram-positive bacteria have a higher level of peptidoglycan in their thicker cell walls. So in a way, this lysozyme kind of is a natural gram-positive like chemical like attacker, and because strep and staph, the things that you normally would have on your skin, are more gram positive, this kind of keeps those in check. The other substance in the skin, which is part of sebum and part of the more glandular secretions of skin, is fatty acid. Because fatty acids are acidic, this can also sort of with a pH effect naturally inhibit a whole variety of pathogens. But for the most part, I want you to think of your skin as being magic. Like it's amazing. Most of the time, your normal just defense is good enough, and we don't see a problem unless there's a breach, like a puncture wound, or maybe something getting into a pore, or I don't know, just a natural crevice or opening. That tends to be where microbes would exploit. It is also interesting to note that over the surface of your skin, which has an enormous flora of microbes, that there are different microbes that habitate different parts of the body. I think this is kind of interesting. I will also mention that this is different for men and women. Women tend to actually have more species of bacteria on their body, but this is kind of uncharted territory in terms of like what is distributed where and why. Like, why are there 100 different species in the belly button and we don't see those other places? It's just kind of cool that you kind of have this map of different distributions of microbes all over different regions of your body. So the first thing you're going to notice with a microbial infection of the skin is typically a rash. So a rash or a lesion can come in a variety of forms, and I want you to get some practice with this vocabulary. So I've kind of defined typical lesion and rash terms here, like a crust, kind of like a dried scab is kind of how I would describe that. A cyst is something that is encapsulating either fluid, pus, which is just like kind of a white, thick, viscous substance, gas sometimes. I would say most commonly fluid filled with kind of a watery fluid, though. A macule is a red spot, no fluid, but it's definitely red. That could be, like you could have a chemical like action with maybe like poison oak or something. That could also be macular. A papule is a small raised bump. A pustule is filled with pus. That one's pretty self-explanatory. Ulcers can start as other types of lesions, but if they open on the surface and there's kind of an open wound, then it's an ulcer. A vesicular rash or a vesicle is small, and by small I mean 1 centimeter or less, usually filled superficially close to the surface of the skin with a little bit of fluid. If those erupt and open, it could definitely be an ulcer. And then a wheal is kind of what you would get from an insect bite, and you probably had one of those. So here's kind of a visual representation of those different types of lesions. And it's just kind of good to know exactly what is different between, a macule and a vesicle, or a vesicle and a pustule. And you'll kind of just get some experience with these. So here's kind of some examples. On the upper left, we have a nice kind of healing over crust. Not sure what caused that lesion to begin with, but definitely some new skin coming under. A cyst on the upper right, see it, how superficial that looks. It could totally easily pop with just mechanical, injury to it. Just moving around can kind of cause those to open up, and then that fluid is sort of released. On the lower left, we have kind of a reddish rash distributed over this dude's lower neck and back region. This is problematic. This could be an allergic reaction, but it could also be a microbial infection, and I would say definitely needs to get checked out for ruling out any potential, bacteremia. And then a papule or a pustule, those two terms I actually kind of look at as pretty interchangeable. This is kind of a deep pimple, is how I would describe that. Like it's got some pressure because it's deeper in the tissue, but it's still going to be full of pus. Here we have a pustule where it's more superficial. You can kind of see that it's full of that whitish pus color. An ulcer, this is sort of on the ankle, is one of the common places where people can get bed sores actually, because it's got a really bony prominence that can cut off blood flow. This could be caused originally by a microbial infection, or it could be an opportunistic infection that is coming into this kind of open, undefended area. Vesicles, I know you don't have a ruler here, but these are all approximately the size of your pencil eraser or less, and these tend to just be distributed all over fairly symmetrically. And here's like a wheal, which is sort of like this typical presentation of like some kind of a chemical reaction happening under there. Let's talk about some specific things that can cause skin infections. The two really most common are staph and strep. We'll do these one at a time. And let's start with staph. And staph comes in sort of a different level of pathogenicity depending on the species. So first we have Staphylococci epidermidis. This is gram-positive. All staph is gram-positive. This is definitely Staphylococci, so that totally makes sense with the name. This is going to have a type of enzyme that is the more pathogenic like property. If you note the presence of that enzyme, coagulase, that usually means it's worse. So for Staph epidermidis, it does not have that enzyme the way that Staphylococcus aureus does. But I will say Staph epidermidis in the wrong place and the wrong time can be an opportunistic infection. This is very common on the surface of your skin, but if it gets into a pore, if it gets into a puncture wound, just because it's coagulase negative doesn't mean that it doesn't have the ability to become a skin infection. But compared to Staph aureus, it is the much less pathogenic or less virulent form. So let's talk about Staph aureus. Staph aureus does have the coagulase enzyme, which means it's going to cause like a blood reaction. Also, it possesses an enzyme called leukocidin. Leukocytes are your body's white blood cells. So this is basically an enzyme that can completely kill your body's immune system cells, which is super sneaky. I will also mention that it has the ability to produce an exotoxin. Remember, gram-positive bacteria produce exotoxins, part of their metabolic process, not part of an outer LPS the way that gram-negative bacteria have toxins, but this will produce what we consider to be an exfoliative toxin. I want you to really remember that because one of the presentations of a staph infection is like your skin peels off, and that is so weird and unique. Like you just don't want to miss it. You don't want to assume that someone has a burn, particularly like a baby who can't really communicate, and miss the presence of a widespread bacteremia. Let's look at a few examples of staph infections. And I will say most of these are going to be Staph aureus infections, but like I said, could be staph, period. So a follicle is at the base of every hair, and folliculitis is basically going to be an infection of those little base hair follicles. These tend to be uniform, distributed at the base of kind of at least an area of hair. And I will say that one of the associations with folliculitis is just lack of access to hygiene, either by choice, mental capacity, homelessness. There's a lot of like pre-existing conditions that could drive, lack of good hygiene. But folliculitis, for the most part, is going to resolve by itself. It's not going to cause a scar, and it's not something we need to be super aggressive about in terms of treating it with antibiotics or whatever. You kind of just need to fix the lifestyle issue. Now, your eyelashes are also considered hairs, but I will say they're kind of like special hairs. Like if you think about it, your eyelashes, they don't grow the same. They kind of have this really sort of thick coarseness to it, and they have additional lubricants associated with them from just the anatomy of an eyelash to just kind of be protective for the eye. So, weird hair is how I would consider an eyelash, and a stye is basically folliculitis of an eyelash follicle, but nobody calls it folliculitis. We call it a stye. These tend to be a little bit more in a sensitive area, so I would increase like the pain associated with a stye. And probably the most annoying thing about a stye is it's just like it's on your face. So like we're very cosmetic, we're very judgy about people's face. We kind of judge, like how you look healthy or not by, what lesions we can see. This one is just a bummer. But like folliculitis, this staph infection should resolve by itself. It might take a week or two. It shouldn't scar. You just kind of want to leave it alone and let, nature run its course. Now, next we have what you might have heard of previous to this course as a boil. A boil is, to me, it's something you do to water. Like, I have this problem with that word because it doesn't really mean anything to me. The word is just more common until you get into medicine and microbiology. And what that is it's kind of an extra large lesion, larger than 1 centimeter, but we can see a singular furuncle, which would be like a larger than 1 centimeter, very blistery type lesion. Or if there's kind of a family of those lesions right under the skin, we would call that a carbuncle. And one of the things I want you to just look at really fast are the two top pictures. The picture on the top left, this is one that has been lanced and drained of its fluid. So, the fluid buildup can be kind of painful, like it can increase the pressure and just like hard to move that part of your body. So it's very typical for that to either rupture by itself or get lanced medically just to ease off that pressure. But do you see the outer pink margin around that kind of more painful looking central lesion? That margin of the infection is really important here. I would say that this is actually localized. So that's good. That means that it's not spreading in a systemic fashion, and that's what you want to see is just containment of that with your immune system. Now compare that to the picture on the top right. I mean, this is another one that looks kind of like it's healing over, it's starting to crust a little bit, but do you see how the pink inflammation is actually spilling away from that kind of radius of inflammation? That's a really bad sign. That actually means it's much more typically going towards a systemic infection, and that can lead to sepsis, that can lead to just a widespread blood infection. That can be catastrophic. So one of the key things to look for here is just like how well is that lesion being contained. And then of course the two on the bottom are kind of just other examples where it's more oozy, ulcerative, gross open wounds. All right, now let's talk some more about some specific Staph aureus infections. Now, these are Staph aureus, not S. epidermidis. The first one that we're going to talk about is called impetigo. And impetigo is often caused by Staph aureus, but I don't want you to just put like a period at the end of that statement because impetigo can be caused by other things. So commonly it's caused by staph. And if you see that the skin is it looks scalded, like it actually looks burned, like a bad first degree or even second degree burn here. That is very unusual in its presentation. It's that exfoliative toxin. And I'm going to be really clear here. If you see exfoliation on the skin with a fever, you must look for a bacterial infection. If you just had a burn from hot water or something, you really shouldn't be throwing a fever from that. So in this case, and because this is typical in non-communicative little babies and toddlers who can't really explain what they're experiencing, this can be misdiagnosed as child abuse, and it has been historically misdiagnosed as child abuse. If you do not catch this as a bacterial infection, it can lead to a systemic blood infection and organ failure, which is toxic shock syndrome. And that can happen in 24 hours. So this association with the exfoliative toxin is super important to me, just because in your most like medically fragile non-communicative patients, this can look weird. Now here is a kind of more like advanced stage of the impetigo where it's actually started to crust over. So here, this kind of looks like it's healing a little bit, and this is not a baby, but this is still basically just a Staph aureus infection. Okay, the other big bad, in addition to staph infections of the skin, is strep. And usually with streptococcal, remember that name kind of tells you exactly how it looks, right? A little chain of circles. We are usually talking about Streptococcus pyogenes. Pyo is a word that means pus. Genes means generates. So this is a pus generating chain of cocci, which is such a great name, honestly. This is beta hemolytic, and if you have not done that blood agar lab activity, I'll just kind of give you the heads up here. Beta hemolysis is the ability of a bacteria to completely digest red blood cells. It is indicative of the highest pathogenicity of hemolysis. So these bacteria can completely destroy and digest your body's blood cells, the red blood cells. There are many serotypes or subspecies of strep, and some of them have like different, pathogenic factors, and you just kind of need to I don't know what you're dealing with, but just seeing that it's strep is not usually enough. Like you want to know like which subspecies it is so that you know what kind of anatomical properties it has. I'm going to mention the complement system really fast if you've not had A&P. The complement is sort of a ancient antimicrobial system as part of your immunity. It does cause like excitement of other areas of your immune system. The reason it's called complement is that's a term that is from math actually. It means it completes the sum of the angles. So this complement system will actually complement or kind of intensify the activity of the other areas of your immune system. And this particular pathogenic protein that we see in the worst types of strep will neutralize the complement. So the problem there is, your full immune system might be capable of, taking this down, but without full activation of 100%, let's say maybe you're at 85%, that may not be enough for this to have the advantage. So let's look at a couple examples of strep infections. First is erysipelas. And the difference between, let's say, erysipelas and impetigo is that impetigo is more on the surface epidermal layers. The erysipelas is a deeper dermal connective tissue layer. So not only is it deeper, and this is a top picture here of erysipelas, this is also in the area where we have the most accessory structures. So like nerves and blood vessels and things that could potentially transport that bacteria to other areas of the body are very easily accessible here. So that's bad. You will also see in some cases that strep can cause impetigo. Similar, it's going to have that kind of crusty, lesion-y grossness on the surface of your skin. I will say oftentimes these lesions are described as having a honey color, which is, you never want to associate food with a lesion, but you know what I mean. It kind of has like this translucent golden quality to the actual dried pussy crust. That can be necessary to sample so that we can do like that subspecies level identification, and of course to rule out a staph infection too. That would be a good idea too. So like I said, impetigo can be caused by those two things, strep and then staph. Now, if you've ever heard the term flesh-eating bacteria, I will say that I don't like that term because any bacteria, if given the opportunity, will eat your flesh. Personally, I just find that too vague. But a lot of times I hear that term associated with invasive group A, which is a serotype or a subspecies of Streptococcus pyogenes. This has a whole variety of pathogenic enzymes and toxins. This is nasty stuff. So this tends to be aggressive. I would just call it aggressive strep infection. But depending on what part of your body it's attacking, we can classify it as cellulitis if it's solid tissue, and that would be sort of like fat, I guess. Myositis if it's attacking muscle. You could certainly have those two together. And then necrotizing fasciitis is attacking the connective tissue compartmentalization of the muscle fibers, muscle bundles, and whole muscles moving into the tendon, and it's just pretty much everything surrounding your muscles. So of course your myositis is associated with necrotizing fasciitis. But the problem with this fascia attack is that it doesn't really heal very well. It's not very vascular. So like it can get ischemic and then necrotic very easily. It's basically decomposing inside your body. And this can require our most severe type of remedy, which would be surgical extraction of that whole area of tissue. And I mean, that could be amputation, it could be removal of wholesale muscles. I mean, you don't just bounce back from necrotizing fasciitis. My next skin infection is one of my very favorites. It's Pseudomonas. Remember, Pseudomonas is the one that walks around, like it kind of stands up on its Lophotrichus flagellae, and it can kind of wander around. It's also very resilient to chemical disinfection. I just always remember those two weird things about Pseudomonas. Like one, it runs away, and two, it can live in bleach and mouthwash. So this is a gram-negative aerobic rod. I want you to remember that this is aerobic because one of the physical treatments for this is actually types of wound management kits that can suck all of the oxygen out of space and create like an anaerobic containment zone. Man, wound management has really come a long way. But I think it's kind of good to know that it needs oxygen. And probably the most unique property of its pathogenicity is it produces a bluish pus. Now, usually pus is anywhere from white to yellow to brown, maybe a little bit bloody, but it's kind of in that warm color family. This is literally bluish green. It's a beautiful turquoise color. It's not right. I don't know of anything else that kind of has that color to it, but if you see it, that is a serious sign of a problem, because how are you going to treat something that is so chemically resistant that it can actually live inside bleach? So, common ways to acquire a Pseudomonas infection are hot tubs. Like, I don't know about like how hot tubs are like kept up, but I think the water can stay in there for a while and you just like dump like chemicals in there like a swimming pool. Yeah, so that could be one way that you could pick up like Pseudomonas from, wherever in your follicles. Otitis externa might be better known to you as swimmer's ear. This is what happens when you get a little water in your external ear canal and you can't get it to drain. Oh, I just hate it when that happens. Like I was like, oh, I just like want it to like suction cup out or whatever. But if that kind of grody water, kind of like hot tub water, but not hot, like from a swimming pool or something, gets in that outer ear, it can kind of create a sort of persistent Pseudomonas infection, and that can actually be really tricky to treat too. Probably the most important to me is that you associate Pseudomonas with after a serious burn. And I mean, serious burn. This isn't like you touched a hot stove. This is like you've had 60% of your body burned, like down to second, third degree land. If Pseudomonas starts to invade that compromised tissue because your skin has been burned off, it's usually when people die from burns, it is the result of a bacterial infection and massive sepsis. And it's basically you just don't have any defenses in your skin anymore. It's very serious. Here's that cute pus. Check it out. This is a diabetic toe. One of the interesting things about diabetes and uncontrolled blood sugar is that the bacteria have more substrate to have food. The blood vasculature is compromised because little teeny tiny blood vessels are actually harmed by high sugar. So, like, there's no immunity here anymore. And then, whatever you're doing, putting your toe in there, whatever your defenses can't stop it from colonizing. And then you see this blue pus. We would probably have to amputate the whole distal foot in this case. That would be a severe but probably safest option. It's awful because then you'd probably have to be in a wheelchair. But that blue pus is a super bad sign. Okay, anthrax. Anthrax could be in three categories. It could be skin, digestive, or respiratory inhalation anthrax. I will say that cutaneous is the most common, and the reason for that is anthrax is a bacteria, Bacillus anthracus, that lives in the dirt. So if you get a dirty wound or you get dirt kind of where your skin has been sort of, I don't know, opened up or something, it's there and it has the potential to be an infection. This is endospore forming, and it has to be because most soil bacteria needs to be to survive. But we don't I feel like part of our society these days is less in the dirt. So we don't need to vaccinate people for it, but we do vaccinate animals that routinely eat grass that has a lot of dirt. So if you're like a cattle person or a farmer, you would be familiar with that stuff. But it is not the most dangerous form of anthrax, I will say that. The most dangerous form of anthrax is actually if you inhale the endospores. That can actually have really very high mortality associated with it. But any kind of dirt that you get into a wound, you're going to run into potential for bacterial infections, and anthrax is just one. Conjunctivitis. So your conjunctiva is this delicate membrane that sits on the very surface of your eyeball. So the interesting thing about the conjunctiva is it's highly vascular. Like this has actually got lots of little blood vessels associated with it, which means it's susceptible. Like, there's tons of things that you could rub into your eye and it could cause conjunctivitis. Do not associate this with any specific pathogen. It's kind of like whatever ails you. If you have a cold, if you have the flu, if you have like crud on your hands, you can basically rub it into your eye. And we will commonly refer to this as pink eye, just because of the inflammation of that membrane and the blood vessels that are there. Usually this kind of goes away by itself. You can get little numbing eye drops that might have a little bit of lidocaine or something in there. But, I kind of personally, this is like a total stereotype. I always thought conjunctivitis was most common in like little kids because, hand hygiene and stuff. But spring break a couple years ago, I totally got conjunctivitis. It was such a bummer because it was like spring break. But oh my God, it hurt, you guys. Like, it was so bad. I couldn't even watch TV. Like, I just had to lay on the couch like an invalid with like a cold compress on my eyes because it was so painful. I was like, oh my God, I never thought it was that bad. Anyway, be like me. Respect the conjunctiva. Don't rub your eyes, especially when you're all snotty and sick. And oh God, I just read this article about COVID. I guess COVID also causes conjunctivitis, which apparently the viral load in your eyes stays pretty high for quite a while, which I think is just crazy. It probably doesn't really have an effect on most people, like, 'cause they're not like touching other people's eyes, but I don't know. I just thought that was interesting. Oh, next, warts. All right, first, there are many forms of viral warts. Many, many, many subtypes, like over 100. But the kind of species level is human papillomavirus. A papilloma is just basically a soft, fleshy mass on your skin, aka a wart. And these can vary in their location, they can vary in their size, and they're not life threatening. They're just kind of unappealing, unsexy, and nobody loves them. I will also say that because there's a lot of different treatments for warts, I mean, everything from nasty chemicals or liquid nitrogen, or I mean, I've seen like ultrasound. I mean, there's just like so many ways that you can treat a wart that I don't believe there's any good way. I think when there's so many different options, it's usually because there isn't one good one, and these are probably just going to come back. This is a lysogenic DNA virus that basically gets inside your DNA and it just kind of gets you when you're down. Next, nobody's favorite is herpes simplex virus. Sometimes you might see that like abbreviated human herpes simplex virus. This is type 1, and this is basically oral cold sores. So same idea. This virus like hangs out in your little nerve endings in the oral, kind of the perioral mucosa. And when you're stressed out, it has activation from cortisol, which is your stress hormone. And then boom, you get a cold sore right before something really important, like school pictures or I don't know, some kind of important person job interview. Like, nobody likes those either. I will kind of remind you that acyclovir is one of the drugs that we discussed in the previous unit. Acyclovir can be a really good medication to limit viral replication in this case. Some people actually use it as a prophylaxis. They'll just take a little acyclovir every day if they can tolerate it, and that sort of suppresses outbreaks, or it at least would kind of de-escalate the intensity of an outbreak. And that drug is actually pretty cheap and successful. For mycoses, these are fungal diseases. Mycoses, we're just going to focus on kind of like sort of small scale microscopic stuff for fungal diseases. They kind of come in three varieties. You can get a face full of spores. That would happen if there's like mold in your world, like black mold or something really nasty, like growing like in your bathroom walls or something. That would be bad. You could eat a poison mushroom, which I highly don't recommend that. They can be extremely toxic for your liver. But you know what? In Oregon, it happens. I don't know, between 5 and 10 people present every year having served some kind of mushroom gravy, not knowing what they're doing, and It's real, right? But for fungal infections of the skin, we want to classify them as sort of the level of the infection. Is it just in the superficial epidermis, making it cutaneous? Is it kind of getting into the dermis, that underlying connective tissue, that subcutaneous? Or is it like completely invading the body and spreading through the blood or the lymph as a systemic infection? Three really super common mycoses that you might be familiar with already are yeast infections, which are, I would actually say yeast infections are always pretty much opportunistic in that they are found in patients that are compromised or do not yet have a competent immune system in the case of like a baby. But sometimes just antibiotics can throw off your balance and then you become susceptible to yeast or something like cancer being treated, killing your immune system, etc. Ringworm, it sounds like a worm, looks like a worm, but it's actually a fungus. And then dandruff. And if you actually look at the ingredients that are in like dandruff shampoo, you should recognize those as being antifungal. All right, let's talk more about mycoses. If you see this word tinea associated with it, it's a fungus, and we do kind of have different body parts that are maybe a little more susceptible to fungal infections, just maybe because they're more moist or there's just different types of hair there. It's interesting to me that we actually have like anatomical regionalization of fungal infections. The three cutaneous, subcutaneous, and systemic, though, I want you to be able to see the difference. Scabies is a bug. It's actually an insect. We treat it with insecticide. So, you know how I said at the beginning of this chapter that like your skin is a really good defense and most things like have to go through a breach? Not scabies. Scabies will basically dig a little hole and start laying eggs inside a nest on intact skin, which is just so freaking nasty. Anyway, I think what's so cool about scabies is that while our insecticide is becoming less effective, we're experimenting with things like petroleum jelly and essential oils, and I don't know, like physical treatments kind of get me all excited. But scabies is pretty easy to if you're sharing clothing or skin to skin contact, those would be the ways to spread that stuff. Lice. Lice can come on the head or body. I think that this is such an interesting insect. It is a bloodsucker. People tend to not like it because it's a bloodsucker. But it can be really hard to get rid of these because look at it. It's got these little hair hooks that just like allow it to like grip onto hair. It's just, I don't know, it's like a monster. Anyway, it also lays a ton of eggs. The eggs are called nits. So if you're a nitpicker, you are a lice egg remover. That's literally what that term means. And I don't think it's derogatory. I think it's awesome. When you pick nits, you basically use a really fine comb and basically pull out all of those little lice babies. I will also say that this particular species of pathogen is becoming more and more resistant to some of our like shampoos and things. So there's a ton of weird alternative treatments, and I'm completely open to those, like mayonnaise, essential oils, like I don't know, all over the place. You should know we used to quarantine kids who had lice just so it didn't like go around schools and stuff, and we don't do that anymore because it just kind of economically disadvantages people. A lot of kids get their food through schools, and I mean maybe it's just kind of like super extra judgmental that we just have to kind of work through it. Here's what nits look like. These are just the little eggs. And can I also tell you that if you have lice or you want to remove lice, you should refer to the CDC guidelines about it because removing nits is different than removing adults. So you kind of have to have a treatment for the nits and a treatment for the adults, or you might not eliminate the problem. You might just eliminate one. Anyway, I always just refer people to the most up to date stuff. Anyway, there's a few practice questions at the end of this chapter, and I'm just going to go over some of these just so that it's not confusing. This is toenail fungus. Toenail fungus is the worst, really hard to get rid of, and this is actually cutaneous. So if you think about like the vascularity and that this is actually just a nail, which is very similar to a hair, just packed together keratin. It is very, very superficial or cutaneous. If you look at the next question, the key here is whether you see the pink kind of inflammation of the connective tissue. That means it's deeper, right? So that's a hint. This is just obvious. Like one of the biggest problems is that fungal infections itch, and people get really, I don't know, embarrassed before they go to the doctor for help. So they try to do a bunch of weird stuff at home. And then by the time it gets to this point, it's just so bad. But like, this is so much harder to treat. People. Anyway, I've given you enough hints. You can do the rest.